I'm Hussein, and I am a pediatrician at Longstreet Clinic. First, I would like to thank you for tuning in today. For those that are not familiar with Longstreet Clinic, we are a primary care and multi-specialty clinic. We have 10 locations throughout North Georgia and more than 200 providers. We represent 19 medical specialties, including 5 pediatric offices. Since the start of this pandemic, we have been working hard and hand in hand with many community partners, including Northeast Georgia Health Systems, Northeast Georgia Physicians Group, and the Department of Public Health, and most importantly, the school system. As vaccines have become available, it was extremely important that the rollout be as efficient and as smooth as we could possibly make it. So we formed a COVID-19 vaccine coalition. Today, we are lucky to have representatives from that coalition here to talk to you about the most recent update regarding the COVID-19 vaccine. And that is the approval of the vaccine for children 12 and above. Vaccinations for adolescents in our community is already underway. In fact, we had a vaccination clinic in my office in Brownston today. We recognize that the vaccine has been approved by the CDC and the FDA, but it still needs the seal of approval from our parents. So that is why we are all here today. We have a great panel. I'm joined today by Dr. Megan Farley. She's a fellow Longstreet Clinic pediatrician. We have Dr. Supriya Manapalli, Northeast Georgia Health Systems Medical Director for Infectious Disease, Dr. Zachary Taylor, Georgia Department of Public Health District 2 Medical Director, and we are lucky to have local school representatives as well. We have Dr. Jeremy Williams, Gainesville City School System Superintendent, Tamara Ederling, Hall County School System Director of Student Services, Andrea Williamson English, Hall County School System Health Services Coordinator, Dawn Wales, Health Services Coordinator for Gainesville City Schools, and Scarlett Pendarvis, Lakeview Academy School Nurse. We have a great panel and lots of experts today. Our goal is to answer the most common questions that we are hearing about the COVID-19 vaccine, specifically related to children, so that you guys can make informed decisions for your family. We'll also talk to our local school representatives so that they can answer questions about how the vaccines are going to impact this coming school year. We have a lot of ground to cover, but if we have time, we will try to answer additional questions. Thank you again to our panelists, and thank you everyone for joining us to listen. I would like to start with Dr. Taylor. Dr. Taylor, can you give us a recap of what is bringing us all here today, and that is the authorization for the COVID-19 vaccine for use in children 12 and older?
Thank you, Dr. Hussein, and greetings to everyone. So about 15 days ago, on the 10th of May, FDA expanded the emergency use authorization for the Pfizer COVID-19 vaccine to include adolescents aged 12 to 15 years of age. And then on 2 days later, the Advisory Committee on Immunization Practices recommended that this vaccine be used in this population. It's important to note, this is the first vaccine that has been approved to be used in this younger population. And it will prevent symptomatic COVID-19 disease in this population and prevent transmission within the community. The Pfizer vaccine is a messenger RNA vaccine. This is a fairly new technology, but we do know a lot about it, and it's an excellent vaccine. It does require 2 doses. They're given in the arm. And generally the second dose is 3 weeks after the first dose, but that's not a strict guideline. You can go up to 2 weeks after that at any time to get that second dose. So how do we know that it works? Well, they did the most strict kind of study to determine this, called a randomized double-blind placebo-controlled trial. This involved 2,200 participants aged 12 to 15 years of age, and the results were that there were 18 cases of COVID-19 in the placebo group the ones that did not receive the vaccine, and there were no cases in the group that received the vaccine. So that's 100% effective, at least in this trial, in preventing COVID-19 infection. They also looked at the immune response in those who had never been infected that received the vaccine, and it was equal to what they observed in persons aged 16 to 25 years of age. All vaccines can cause a reaction, and this vaccine is no different. These reactions are normal. It really is a demonstration that the immune response is happening in the body. So it's expected and normal, and that includes a local reaction, which may include arm pain at the site of injection, swelling, redness, those types of reactions locally. It can also include some systemic reactions. So people can have fevers, aches and pains, and maybe feel like they have the flu for a day or two. All of these things resolve probably within 24 to 48 hours. And again, this is not unexpected, and it's not abnormal for that to happen. There were no serious adverse events in this trial attributable to the vaccine. There are some contraindications, or at least there's one contraindication to the vaccine, and that is if you've ever had a severe allergic reaction or an immediate allergic reaction to the vaccine itself. So if you had a severe allergic reaction with the first dose, we would not give you the second dose of this vaccine. If you've been recently infected, you can receive the vaccine after recovery. We think that there's immunity after infection that lasts at least 3 months, so you may want to wait a few weeks or a month prior to receiving the vaccine, but there's no contraindication to you receiving the vaccine if you've been previously infected. Children who've had a severe reaction to COVID-19 disease called multi-system inflammatory syndrome, they should consult with their pediatrician prior to getting the vaccine. So thank you, Dr. Hussain.
Yeah, thank you for that information, very helpful. And thank you for pointing out that the 3-week timeline, while that's what's recommended, I know that during the summer, lots of people are traveling. So if they can't get the second vaccine within that 3-week window, you can get it later. Dr. Taylor, can you tell us anything else about the approval process of this vaccine?
I think a lot of people are concerned about the fact that we call it an emergency use authorization as opposed to approval, and they think that the vaccine and the studies were rushed. And I want to assure people that that's not the case. All of the steps that are taken in the usual approval process of a vaccine were followed. The trial and the number of people that were in the trial are the same as we would see in the usual approval process of a vaccine. The things that sped up the process for this particular vaccine is that they used groups of trial participants that had been set up previously, so that speeded up the process of recruiting people to participate in the trial. And because when you think about it, what we're actually looking at are the number of cases that occur as opposed to the total number of participants. So because we had so much COVID-19 occurring in our communities, we were able to see this difference in the effectiveness of the vaccine faster than we would necessarily with another type of illness. So I want to assure people that this is a safe, it's an effective vaccine, and the processes that needed to be followed were followed for the emergency use authorization. I expect that fairly soon we will have full authorization of the Pfizer vaccine by the FDA, so that particular issue will be resolved.
That's great to hear. And I know that Moderna announced they're getting close to asking for authorization of their vaccine for the same age group. So we're excited to hear that. And finally, Dr. Taylor, where can children 12 and above get this vaccine?
Well, obviously they can call their pediatrician and they can get it from most pediatric offices. Not all of them carry it, but I know that Longstreet does, and NGPG and other pediatric offices, as well as probably some of the local pharmacies like Walgreens or Kroger's. They need to call and see if they have the Pfizer vaccine available. If they want to, we have a vaccination site at the University of North Georgia, the Oakwood campus here in Hall County, in the athletic building. It's open Monday through Friday from 9 to 4 p.m. They can just walk in to get the vaccine there. It does require that they have parental consent. Older teens can obviously drive themselves there if they like, as long as they have the parental consent. For the younger children, obviously, we would want them to have an adult with them, but it could be an adult sibling or an adult relative, and doesn't necessarily have to be the parent that arrives with them. They just need to have that parental consent with them.
Thank you so much. And Longstreet Clinic is, of course, vaccinating right now. I can give you our phone number for the vaccine hotline. That's 678-207-4402. You can also call your pediatrician's office. I would like to add an important point here. When this vaccine was first approved, the CDC recommended that it only be given alone. The CDC has recently changed its guidance so that this vaccine can also be administered with other routine vaccinations. This is so important because last year, especially during the height of the pandemic, we saw a sharp decline in visits to our offices and a decline in routine wellness checkups. We are happy to have patients back in the office getting caught up on their vaccines. And we're also happy that with this new decision from the CDC, we can administer the COVID vaccine along with the routine childhood vaccinations. I would like to go to Dr. Manapalli now. Dr. Manapalli, Dr. Taylor did touch on the speed of the approval of this vaccine, but this is a question I get a lot. People feel like this was rushed. Can you talk about the timeline a little bit?
Yes, again, thank you for this opportunity. And just want to add about the vaccine access. There is a vaccine clinic in collaboration with the city schools and Northeast Georgia Health System for this 27th as well. And it's open to the public, and they can use the link under the Northeast Georgia Health System COVID page to register. And talking about the vaccine approval process, I don't think any vaccine in our lifetime has received so much scrutiny like this one. And again, truly the idea of a new drug, vaccine, or therapeutic really starts in the lab. And once it's developed, then they test it in the phase 1 in a few hundreds of people to identify what's the correct dose, what are the side effects, is it doing what it is supposed to do for a vaccine, is it eliciting the immune response? And then once they learn from the phase 1, then if based on that it moves to phase 2. Here, the vaccine is tested in a few thousands of people. Again, they're monitoring if the vaccine is eliciting the immune response, continuing to monitor for the side effects. And then in the phase 3, as Dr. Taylor alluded to, where it's a blinded study randomized to placebo group and those who get the vaccine. And here they're learning more about the immune response. Is the vaccine preventing the disease? So they're learning more about that. And once the data is overwhelming, where the benefit outweighs the risk, and when we are in a pandemic, that's where FDA, following all the process, issued the emergency use authorization. And even after the full approval from the FDA is received, then it moves on to phase 4, where these study participants are monitored for a few years to see if there are any long-term effects. And from what we know from other vaccines, most of any adverse events as they are rare, occur within the first 2 months of the vaccine. So the long-term effects are very rare. And as Dr. Taylor mentioned, the only reason we have the vaccine available to us in record time, one, we are in a pandemic, it's an emergency situation, we need to save lives. And due to the financial investment that was made and the international collaboration and the scientific minds coming together, so that even when they were doing the testing and going through the approval process, they were already investing in manufacturing and development of the vaccination. So once the approval was received, we had the doses ready to give it to people.
Thank you for pointing that out, that there's been a lot of scrutiny and that no steps were skipped in the development.
Dr. Add one more thing.
Yes.
Before the EUA for the adolescents, millions of adults have received the vaccination. So there is data since the EUA from the adults. There are multiple studies across the world. There are multiple studies, one after other, that has shown the same immune response, effectiveness in preventing the disease, the adverse events, which are very minimal, resolve within 7 days. So that has been repeated in adult studies, multiple of them.
Thank you. I want to talk a little bit about sort of the younger population. There is some speculation that the younger population is either delaying or not planning on getting the vaccine, perhaps because they don't feel at risk for serious illness, perhaps because the positivity rates are declining. Can you speak a bit about what studies are finding in terms of what the vaccination means as far as transmission, and why it's still important for the younger population to get vaccinated?
Yes, that's a great question. I think a few things what we do know is that the vaccine is effective. I think there's been a report early in May where they noted that among the new cases, 22% are in children. That's a change in demographics from what it was in the beginning of the pandemic. I think earlier it was maybe 3%. So 22% means 1 in 5 children. So we're detecting more infections in the children, and the reason relatively to adults. And the reason for that change in demographics could be we started vaccinating the adults first. And also, yes, it is true that most children have mild or asymptomatic infection, but they can transmit it to others. And also, we have noted that the breakthrough infections among vaccinated adults, the studies have shown that the viral load is very low, at least 4-fold lower. So the risk of transmission is lower. And if we really want to achieve herd immunity, we need to vaccinate more people in the community. And to achieve that widespread vaccination in the community, we need to vaccinate our children. So I think it's a great positive step that now the adolescents can actually get the vaccination.
Yeah, that's great to hear. There are lots of benefits, of course, to being fully vaccinated. The CDC recently released guidelines saying that you no longer need to be fully masked if you're fully vaccinated. Can you walk us through what being fully vaccinated means for us?
I think it's a huge positive step. Relaxing some of these restrictions, I think, gives me a lot of hope. And for a lot of people, it means different things. And fully vaccinated, based on CDC guidance now, that means 2 weeks from receiving the second dose of the Pfizer, or if for any vaccination, completing the series, and you should have completed 2 weeks, because the body needs that time to develop the antibodies to protect us from the infection. So those who are fully vaccinated do not need to wear a mask or physically distance in majority of the small or large gatherings. And even if they're exposed to someone with COVID-19, they don't need to quarantine. That means no missed school, no missed work, and only need to get tested if they develop symptoms, because the risk of developing the infection, if they're fully vaccinated, is very, very low.
That sounds wonderful to me. I think we're all looking forward to that. And finally, one last question for you. We had some parents ask about the effectiveness of this vaccine, how long the effectiveness lasts. Should they get the vaccine closer to the start of the school year? Should they get it now? What would you tell them?
Yes, we do not know how long the immunity from the vaccine lasts, but what we do know from the studies from the adults is that they have studied them up to 6 months following the vaccination, and the vaccine protected them at least for the 6 months that they studied. That does not mean it does not protect them longer. It's just that they're continuing to study. So we just need to wait for more data, information, evidence, and guidance from CDC. Do we need a booster? How long the vaccine immunity lasts? And just one thing I want to add when it comes to vaccinating our children is that, yes, it's true that most of them have mild or asymptomatic infection, but those of us have heard of someone who has had serious illness, severe illness, critical illness, who is a child who required ICU admission, being on ventilator, and some have lost lives as well. So the vaccine gives really a lot of hope that we can save more lives.
Thank you. And that's a really great point. I have taken care of patients that are, children that are having long-term symptoms from COVID. So children can be affected. So thank you for pointing that out. I would like to move to Dr. Farley, my colleague and fellow pediatrician. Dr. Farley, can you tell me a little bit about the questions and concerns that you're hearing around our offices? I know a lot of those are probably going to be what I'm hearing as well.
Of course. Thank you for including me. Really, Dr. Taylor and Dr. Montpelli have gone over so much of the concerns that we're seeing, but I think the biggest concerns are with sort of the, how quick was it developed and how long will it last? And those are evolving questions. And specifically for children, I think that there's concern about, side effects, and it's been in the news. What about fertility? What about affecting your menstrual cycle? All sorts of things. The biggest answer is all of these, any vaccine is risk versus benefit. So, they really, and a lot of these I think are signs that the vaccine reporting is working well. But for example, the issues with the myocarditis in the children, obviously that's under evaluation, but we know that if you're an adolescent and you have COVID, you're going to have a higher risk of having heart issues. Whereas so far, it appears that the numbers from the reported issues of myocarditis seem to be more just in line with the general population, what we would see at any time. And so I think the bigger thing for adolescents is that I think, or the message I guess I have for the parents is to talk to your children. I mean, 12 to 15-year-olds, older teenagers, they're very aware of what's going on. They're getting good and bad information from online and everywhere else. And we have seen such incredibly high anxiety and depression over the last year, and disruption of everything that's normal for them. And this is probably the first disease for most of them, really any of us, in a lot of ways, that we all, we know somebody's parent, grandparent, neighbor, who either had died or had a tough time with this. And so children are very aware and very stressed, and parents might be surprised sometimes at just how aware their kids are. And so I think we really need to pay attention to that.
Yeah, thank you for that. What are you telling patients and their parents about some of these concerns, like, kids that have asthma or allergies to other things? What are you telling them about getting the COVID vaccine?
Well, obviously the big message is go talk to your pediatrician, because every kid's different and they might have different issues. But for example, the menstrual cycle, I think the answer to that is, well, sure, it could affect your menstrual cycle. Menstrual cycles are finicky and can be affected by viruses, vaccines, stress, you name it. Drop of a hat, somebody might miss a cycle or get off. And so that would be basically an expected response, in my opinion, for children. And so I think all those kinds of concerns just need to be addressed really one-on-one.
I completely agree with you. We understand that the most important thing is your child's health and your child's well-being. And we urge you to talk to your pediatrician about your specific concerns. Please take what you see on social media with a grain of salt, and discuss your concerns anyone can take one piece of information and blow it out of proportion. So please, we're here for you. Reach out to your pediatrician. Thank you, Dr. Farley. I would now like to move on to the guests from our school system. First, I want to say thank you so much for being here and congratulations for making it through this challenging school year. I know that I speak for our community in saying that we appreciate everything you've done to keep our kids and the community safe. Here with us today again is Dr. Jeremy Williams from Gainesville City School System Superintendent, Tamara Ederling, Hall County School System Director of Student Services, Andrea Williamson English, Hall County School System Health Services Coordinator, and Scarlett Pendarvis from Lakeview Academy School Nurse. I'm going to direct each of these questions to one person, but please feel free to jump in with any additional thoughts. Jeremy, we'll start with you. I know the current school year just ended, but can you speak on the factors that may go into decisions for the upcoming school year?
So first of all, what a difference a year makes. You know, this time last year, we were having a ton of Zoom meetings just to plan of what August would look like, how we would serve our kids. And I think the interesting part of all of it is we learned a few things that we don't want to just throw out because the cases are going down. So for us as a school system, an example is open house. In the past, open house, let's take Centennial Arts Academy, for example, you have 800 to 900 students, and all of those families are trying to come to an open house in a 3-hour period. You can't do that in COVID. And so what we did this past year was we took open house, spread it out across 5 days where families came in every 20 minutes, met with the grade level teacher, developed that relationship from the beginning. And so we'll be doing that again this next year, except 5 days, it'll be 3 days, and kind of condensed a little bit more because we learned that it helped us start the school year off right. It helped our parents see the protocols we put into place and just start those relationships off the way we wanted them started off. Another thing we did is we staggered our start. And I know Hall County staggered their start a little bit as well. We brought all of our pre-K to second grade kids in, 6th grade, 9th and 10th, the kids that were new to a school. You know, there's nothing worse than coming to a new school and not knowing where to go when you didn't have that chance at the end of the previous school year to get into the school and get to move around and know the environment. And so we'll have staggered starts again. One thing that we did learn, and we're starting to kind of peel back a little bit more, is where can we relax some of our restrictions that we've had? We've really been in stage 2 as a district since October. And we decided late February, early March, look, let's just finish the year with what got us to this point. We were able to vaccinate about 500 or so employees in mid-March. And so we have a number of employees who've had that opportunity. About 60 to 65% of our employees have been vaccinated. So we're transitioning. We quarantined approximately 3,000 students this year as a school system due to possible exposure at school or at home. We had fewer than 400 cases as an entire district with 8,000 students. So we felt like our numbers looked really positive. There were times, of course, that it got kind of high, but we felt like the mitigation protocols we had in place just really set us up to be able to start the year off from a standpoint of virtual or remote instruction, but really have a successful year face-to-face. And our goal as we go into next school year is how can we then move into stage 3? That if we need to open up and release some of those restrictions a little bit more, how can we do that in a successful way? And we look forward to getting feedback from some of our family members and especially our admin, but mid-July is about when we're anticipating that final expectation and report to come out to families about how we're going to start school. So what does that mean about masks and social distancing and busing and all of that good stuff? So we learned some great lessons that we're going to keep into place with some minor modifications.
Thank you for all your efforts this year and hopefully for good luck for a good school year coming up. I would like to move on to Scarlett. Scarlett, do you anticipate requiring the COVID-19 vaccine for in-person learning?
We do not anticipate requirement. We are highly encouraging it. We also had a great vaccination effort at school. We have about a 70 to 75% vaccination rate with our faculty and staff. We have vaccinated approximately 55% of the 16 to 18-year-old group. And since the 12 to 15 group was announced a little later, that kind of ran into end of year, but I sent out to parents some opportunities for some dedicated vaccine sites that they could go to, and have received some positive feedback. A lot of that age group has begun this series. But the answer is no, we don't anticipate requiring the vaccine, but we do highly encourage the vaccine so that we can reach, as a school community, sort of that herd immunity, at least in our little bubble, if you will.
And that being said, Andrea, I would like to direct this to you. Do you anticipate that there will be different procedures for students based on their vaccination status, specifically regarding quarantine and contact tracing for those that are vaccinated?
Dr. Hussein, thank you for having me. And yes, I'm very excited to say that if a child is exposed, whether at home or at school, to the COVID virus, they will not be required to quarantine, which means that they'll be able to come to school, they'll be able to participate in all their extracurricular activities, and mom and dad do not have to stay home. So I hope that'll be very positive information for everyone to hear, and also to let parents know the family will be notified if there is an exposure at school. That will still continue, but they will not have to quarantine.
I know that a lot of parents and a lot of children will be very happy to hear that. That's very exciting. Jeremy, I'd like to go back to you. A lot of parents have been asking about masks. What are your thoughts on masks for the upcoming school year?
You know, our goal is going to be to return to a face-to-face environment in August. One thing that we noticed, and Mr. Schofield and I spoke about this on a couple of occasions, when we both started back to school in August and then again in January, once families knew that we were coming back, some behaviors changed that then allowed us to come back. And once kids got into the routines of school, you saw a lot of the numbers start to decline. Locally, we did continue through mask. I believe Hall County, about a week or so, a couple weeks left, did make it optional, I believe, for elementary age students. And so we actually, yesterday was our first day that if you've been vaccinated, you're not required to wear a mask. We waited until our students were off campus. We waited till all of our teachers were off campus. But we did start yesterday with all of our admin and anybody who works a year-round schedule. It'll be an experiment for us to see how it goes throughout the summer, to see if there are positive cases, how the contact tracing will occur. And so one thing we do anticipate doing, and this is just kind of throwing it out there just from conversations we've had, when you look at open house, for example, you are now taking people coming from all over the summer, wherever they went, whatever they were doing, coming to an open house environment into the school. We've had conversations about requiring masks during open house or the first couple of weeks of school, just to see how things settle down. I would say it's really too early to make a definite decision. We know that some school systems around us did not require masks all school year, and they saw similar peaks and valleys the same time we saw peaks and valleys. So we're going to continue to monitor that data. We'll continue to have conversations with Hall County schools and be on a similar page, because that is something that I know the community appreciated, is that both school systems having a similar expectation, because then the finger pointing kind of subsides a little bit, and you're not put in a tough position. So between all of our healthcare partners, Hall County schools, and both city and county government, we felt like we made what was the best decision at the time. And over these next couple of months, we hope to have enough information to make the best decision at that time as well.
A lot of collaboration happening, so we truly appreciate that. Scarlett, I'd like to go back to you. What about class and classroom structure for the next year? Are there going to be mitigating strategies you think that will continue from this year on to next year?
Sure. We will definitely continue the disinfecting, the cleaning, and that kind of thing. And hand washing. The pandemic sort of spurred a new campaign on hand washing, which as a school nurse was fabulous. And we've seen a great decrease, and I have seen a significant decrease with our mitigating strategies this year in visits to the infirmary and illness in general. So yes, we will keep some of those. I think our task force will continue, and we will meet throughout the summer as we have last summer and throughout the year. And we will also align with CDC and Department of Health guidelines, just as we have this entire time. So when we receive those new guidelines from those safe return to school guidelines, we'll discern those and then decide as a task force what best fits for our student population and for our faculty and staff as far as what to keep in place.
Yes, hand washing will continue to be important. Tamara, I'd like to go to you with a very important question. What mental health implications have you seen from the pandemic, and how are you preparing to address these in the upcoming school year?
Thank you for having me. It's an honor and privilege to serve alongside all of these colleagues here tonight and in our community. If one thing we learned from COVID is that students need school and that we provide many protective factors for our students and our families. And we know that we had mental health concerns prior to COVID, and now, of course, those are just exacerbated. And so if we have to say that there was a gift of COVID, one of those was a little bit of, as Dr. Williams talked about, a staggered time back. So we had some time with our staff members, and every one of our staff members went through a mental health and trauma awareness course. So all 3,500 students, there's 4 teams who went out to every single school leading this training. And our superintendent was a part of this team as well. And he took that show, we call it So on the Road. So providing that training for our staff members. And now we have a next phase going into that for our staff members about building resiliency skills in students. And how do we de-escalate? How do we recognize anxiety and depression? As Dr. Farley mentioned, how much it's increased for our adolescents and how to be able to identify that. And we're also blessed to have been given a Project Aware grant for mental health, one of 3 districts in the state. And we're providing services for students. We're looking at the whole child. They're not just academic beings. They have behavioral and social emotional learning needs as well. And so looking at each tier 1 is what every student gets, and tier 2, and if you need small group instruction, and then tier 3, personal counseling. And so we are using our CARES Act money and our Project Aware money to actually hire interventionists, and not just for academics. They will be providing small group instruction for students who are struggling with anxiety, depression, and deregulation. And so not only are we informing and putting tools in our tool belt of our adults, but then also what are we doing to provide these services for our students, and then again for our family members. So we can teach these skills to students in isolation, but unless that we teach these skills for parents to use as well. So it's connecting the family unit to be able to use these skills, and also students in crisis. We have a crisis team. So when students are in crisis, or even our staff or faculty members, which we have seen an increase in that this year, we have resources and people that will reach out and help. So we're really proud of this work and continuing that this next school year.
Thank you for that important work that you're doing. Mental health has been a big challenge. So we see that in our offices and in children. So you're doing the hard work for the community. We truly appreciate that. Andrea, I would like to go back to you. What would you say has been the greatest lesson you've learned during COVID? And are there any takeaways you think that will continue as things start to improve?
Well, we've learned a lot over the last year, and it has certainly been a growing year. And I would say for the things that I took away from it was that our mitigating strategies worked. And most of them were popular. We had a few unpopular, as you can imagine, but they worked, and we were able to provide in-school instruction for many, many children, for maximizing those days that they could actually be in school. So we truly believe mitigating strategies work, and our goal is obviously that the pandemic continue to decrease so that we can continue to pull back on those and just keep those tried and true, that hand washing, thank you, Scarlett, cough and sneeze in your sleeve, and stay home when you are sick. And then I would say my second one was partnerships are key. We could not have done this if we had not had the fabulous team that we've had in Hall County. I mean, we reached our hands, those hands were well received. The Department of Public Health, Northeast Georgia Health System, all of our pediatricians like Longstreet Clinic, our local pharmacies, United Way, who made a gazillion masks and gave them away for free, and so many more. And I think one thing that we can take away from COVID is that when we all work together, we can overcome.
You're absolutely right. A lot of collaboration, and that's really helped us all get through this. We do have a couple of questions from Facebook that I would like to get to. Dr. Benapali, if I can ask you this question, when will children younger than 12 be eligible for the COVID vaccine? What about infants? And then specifically related to pregnant women, do we know that if a pregnant woman is vaccinated late in her pregnancy, does that offer some protection to the baby?
Great questions. We are hoping, again, it's only a speculation, and Dr. Taylor, please add that before the end of this year, we'll have some evidence to support approval for children younger than 12 years. It's just a speculation at this point. And regarding pregnant women and COVID-19 vaccines, there have been some studies published that actually showed the safety profile of the vaccines in pregnant women, and some of them have some studies in lactating mothers have shown even transfer of antibodies to the babies.
Yeah, I'd only add that the issue for children younger than 12 is that they have to find the appropriate dose. They use the adult dose for the children 12 to 15, but with the smaller children, they have to find what dose is appropriate for what weight. So right now they're studying that, and they're trying to determine the doses. And once they determine the dose, they'll be able to start the clinical trials. So it will be a little bit longer before we have the vaccine available for the younger age groups.
And then one more that I hear a lot in my offices, and Dr. Benapali or Dr. Taylor, if either of you can take this one. The concern for some people are that the long-term effects of this vaccine. So the question here is that the phase 4 studies usually are long-term effects. That's what phase 4 is looking at. So how do we know what the long-term effects of this vaccine will be?
Great question. Dr. Taylor, go ahead.
No, I was just going to say, phase 4 studies, we're really looking at people that are vaccinated within the general population. What we're really looking for are very rare adverse events. So these are adverse events that may occur in every 5-10 million people. So that's what we're doing primarily with these longer term studies. The fact is that if someone's going to have an adverse event from a vaccination, it usually almost always and probably always happens in a very short period of time after the vaccination. You don't see an adverse event from a vaccination years after you've been vaccinated. So what we're trying to do with these longer term, and we follow people and adverse events are reported, we're trying to identify if there are any of these very rare adverse events that may occur when we've vaccinated several million people. I want to point out that in the U.S. today, and this is not across the globe, but in the U.S. alone, we've vaccinated over 150 million people. So adverse events are incredibly rare with all of these vaccines that we're using. I mean, Dr. Manipal, you may want to add.
I think you covered everything, Dr. Taylor. Just to add that, just if we take from the timeline of when the study started in the adults to now, because the study started last summer, so we have not heard of any long-term effects, because most of these any adverse events happen within 2 weeks of 2 months of the vaccination, and most of them happen within that first 7 to 10 days, and these are mild adverse events, and so that's extremely rare. And it's just that I think one of the things we need to understand about the vaccinations is that we also have data to extrapolate from a lot of the other vaccines. So I don't think we Historically, long-term side effects are extremely rare with any of them. And the systems we have in place to identify these rare side effects, the VAERS system or the vSafe system, they are doing the job they're supposed to be. And the data is being shared very transparently. I'm sure all of us have heard about the J&J. I know that's not available for adolescents, but I just want to mention that something so rare was identified because the systems we have in place to detect these adverse events are working.
Okay, we do have another question from Facebook. How will schools and pediatricians determine who is vaccinated and who is not? I can take this question. So Georgia has a great system called GRIT. Whenever a child is vaccinated, that goes into the GRIT system. And we can definitely look up that information so we can make sure that if your child got a vaccine from a pharmacy or one of the mass vaccination sites or one of our offices, it should be up in the GRIT system. And not only the COVID vaccine, but all the other vaccines that children get, it goes into the GRIT system as well. I would like to open it up to just anyone have any final comments or any points that they would like to make.
Yeah, I'd like to add, Dr. Manapali touched on a little bit, this Thursday, May 27th at Gainesville High School Gymnasium from 11 a.m. to 7 p.m. is a vaccine clinic that's available. It does require a sign up. We are sending messages out to our families this evening and tomorrow as well. I believe the information is on the NGHS webpage. This is open to anybody, whether it's 12 and up or it's Hall County students, Gainesville City families. And then we have a follow-up vaccination clinic set for Thursday, June the 24th. So the first vaccine would be this Thursday, then the follow-up would be Thursday, June 24th. So we look forward to offering that to our families that may not be able to get to some of the other locations. The more we can get vaccinated before we return to school, the better information we will have to make decisions.
And I would like to add, I know we're focusing on children from 12 to 15-year-olds, but parents, you should also get your vaccine. And in Basel today, we vaccinated adults with their children as well. So it's important to model that behavior, and you can make it a whole family affair and get everyone who's eligible to vaccinate as well.
If I can add one thing about the change in the strategy, and Dr. Taylor, please add to that, we want to make vaccines as accessible, available, and convenient to the patients, the families, and everyone in the community. So we have moved away from the no dose wasted strategy to no arm wasted. So we really, really want to make the vaccine as accessible and convenient to people. So same thing we're doing in NGPG clinics. If there is a family member or someone accompanying a child, they can get the vaccine as well.
I just wanted to jump in too, and you're talking about, obviously this is for adolescents and 12 to 15, but kind of just to add to what Dr. Hussain said, the more that the parents can vaccinate in terms of, well, what about my younger child or my infant, the more protection that a parent has and other people who are around the child will certainly provide protection, especially if you have children, all children, but there does seem to be some more risk for medically fragile children, whether metabolic or other underlying issues. And correct me if I'm wrong, but also some risks that we see in the adult world in terms of obesity and diabetes and so forth, also being a problem for adolescents and I presume for younger children as well. So just to put that out there.
Thank you. Thank you all so much for joining us. Thank you, Dr. Farley, Dr. Manapali, Dr. Taylor, Dr. Williams, Tamara, Scarlett, and Andrea for joining me today. Thank you all in the community for taking the time out to listen. We know that parents out there want to make the best decisions for their families, and we hope that we have helped you today in that process. Please share this post if you find this information useful. Please reach out to your pediatrician with any of your concerns. We are here for you. We are here to serve our community. And please get vaccinated. Thank you again for tuning in.
Thank you.
Thank you.